Call out the doctor's immunity in America's delay, deny, defend, wars. Calling out status quo journalists for spinning the narrative away from doctors' immunity in America as the healthcare debate in America rages on. Journalists like those at Status Quo have been instrumental in shedding light on the corruption and greed of insurance companies. While their coverage of profiteering within the healthcare industry is essential, their narrative misses a critical component of the systemic harm inflicted upon patients: the role of doctors who are protected by state immunity. These doctors are not mere bystanders, they are tools and shields used by insurance companies to deny care, harm patients, and wage a war on the working class through healthcare systems designed to fail us. Free care and calls for Medicare for all or state single-payer systems are noble aspirations, but they will remain out of reach unless we address the root of the problem. Patients need their civil rights restored. The harm caused by negligent or complicit doctors is not frivolous, it is deliberate, systemic, and often catastrophic. By failing to hold these doctors accountable, journalists and activists are perpetuating a narrative that ignores the structural violence being inflicted on workers and patients alike. Doctors as tools and shields for insurers. Doctors in the United States are often granted state immunity, shielding them from liability for their actions in cases involving harm under $250,000. This immunity, crafted and protected by organizations like the American Legislative Exchange Council, allows doctors to act as enforcers for insurance companies. They deny care, reject claims, and provide biased evaluations that strip injured workers, veterans, and disabled individuals of the benefits they desperately need. This systemic denial of care is not limited to private insurance. It permeates the VA, SSDI, state and federal workers' compensation systems, and private health plans. Doctors are complicit in this system, wielding their pens as weapons to deny pain medication, mental health support, and critical treatments. They become instruments of harm, safeguarded by laws that view patient grievances as frivolous while enabling private equity profiteers to line their pockets. The silence of the liberal progressive left, while liberal progressives and organizations like the UAW, Democratic Socialists, and other left-leaning groups loudly decry the practices of insurance companies, they remain deafeningly silent on the issue of doctor immunity. Figures like Kshama Sawant, who purport to champion the working class, fail to address how doctors are being used as foot soldiers in a war against injured workers and patients. This omission is not accidental, it is strategic. By focusing solely on the greed of insurance companies, these groups distract from the deeper issue, the legal frameworks that allow doctors to harm with impunity. This silence is a betrayal of the very people these groups claim to represent. It is a dog and pony show designed to pacify the public while real change remains elusive. ALEC's role in rigging state laws. ALEC and its Republican business allies have been instrumental in crafting state laws that protect doctors from accountability. These laws have created a healthcare landscape where harm is normalized and justice for patients is unattainable. Democrats and progressives, even those who claim to oppose ALEC's influence, have done little to challenge this status quo. Their failure to call out the role of doctors in perpetuating this system makes them complicit in the ongoing harm. The real cost of doctor immunity: when doctors deny care, it is not just a matter of inconvenience, it is a matter of life and death. Patients are denied essential treatments, their pain is ignored, and their suffering is dismissed as unworthy of legal recourse. This is not just a healthcare issue, it is a human rights issue. The denial system, backed by state immunity for doctors, is a direct assault on workers, veterans, and the most vulnerable members of society. A call to action to truly fix healthcare in America: we must restore patients' civil rights, repeal state immunity laws that protect doctors from accountability, expose the role of doctors in denial systems. Journalists, activists, and policymakers must shine a light on how doctors are used to harm patients. Hold politicians accountable, demand that Democrats, progressives, and Republicans alike address the systemic injustice of doctor immunity and its role in healthcare corruption. Reclaim the narrative, shift the focus from insurance companies alone to the entire ecosystem of harm, including doctors and the legal protections that shield them. Without addressing these issues, calls for universal healthcare or single-payer systems will remain hollow. The healthcare system's harm to patients, particularly those with claims under $250,000, must no longer be deemed frivolous. It is time to confront the sadistic misuse of state immunity and demand accountability from those who harm patients with their pens and their silence. Conclusion: the progressive left and labor activists must stop spinning narratives that shield doctors from scrutiny. Journalists like those at Status Quo have a responsibility to tell the whole story. Until we dismantle the legal protections that enable doctors to act as tools for insurance companies, America's healthcare crisis will remain unresolved. The time to act is now, for justice, accountability, and the restoration of patients' rights. Bible verse on doing no harm, Proverbs 3 verse 27, do not withhold good from those to whom it is due, when it is in your power to act. American Founding Father quote on duty and justice, Thomas Jefferson, the care of human life and happiness, and not their destruction, is the first and only legitimate object of good government. Famous doctors quote on the oath to do no harm, Hippocrates, I will use treatment to help the sick according to my ability and judgment, but I will never use it to injure or wrong them. Copy and paste and send this letter to your lawmakers. Subject: Demand for accountability and reform in healthcare. Dear lawmakers, as concerned American citizens, we are writing to express our deep frustration with the current state of our healthcare system and the urgent need for meaningful reform. While much attention has been given to the actions of insurance companies, an equally critical issue remains largely unaddressed: the unchecked harm caused by doctors protected by state immunity. This protection enables harm to patients to go unpoliced and perpetuates systemic injustice within our healthcare system. Doctors, who should be healers and advocates for their patients, are often used as tools by insurance companies to deny necessary care. With state immunity shielding them from accountability, patients have no recourse when harmed by these denials. This legal framework not only fails to protect patients but also enables a system where the harm inflicted on individuals is dismissed as frivolous simply because it falls below a $250,000 threshold. This injustice is particularly harmful to injured workers, veterans, and disabled individuals who are already vulnerable. We urge you to take the following actions to restore accountability and justice to our healthcare system: repeal state immunity laws, eliminate legal protections that shield doctors from being held accountable for harm caused by their actions, support universal healthcare, advocate for a healthcare system that prioritizes patient care over corporate profit and ensures equitable access for all. Investigate conflicts of interest, address the role of doctors who act as agents of denial for insurance companies, enabling systemic harm. Uphold patients' rights, restore civil rights for patients to seek justice, and hold all parties accountable for negligence and harm. Healthcare reform must include holding doctors accountable for their actions. Without this critical step, any attempt to fix our system will be incomplete and fail to address the root causes of harm. It is not enough to call out insurance companies without also addressing the laws that enable doctors to act with impunity. We look to you as our elected representative to champion the rights of patients and ensure that no American suffers harm without the opportunity for justice. Please act now to protect the people you serve and restore integrity to our healthcare system. Sincerely, concerned American citizens.